Hello, Mr. T.
Good evening, Mr. Abbas.
How are you today?
Today I'm good, but I'm a little tired because my wife and my two daughters they go to France 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 government in Vietnam.
Yes, I've seen that. Mr. Nguyen went to the Department of Immigration, right?
Mm.
Yeah. What did you do there?
Uh, um, government France is have even uh for the student.
Oh, I see. I just want to see um, what she told me. Yeah, to the embassy. She went to the embassy.
Embassy.
Yeah.
Yeah.
Why did she go to the embassy?
Mm, the 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 older daughter she apply for exam.
Oh, okay.
Yes.
Okay, I understand.
She learned she learned French from when she go to the school.
Oh, I see.
Nowadays she reach level C1, maybe
Oh, I
C2.
see.
Yes.
Okay, that's good. So when are you leaving for Paris? When are you flying to there? When is your flight departing?
Mm, at the weekend, big weekend,
When? Saturday or Sunday?
Sunday.
Oh, on Sunday.
Yeah.
Ah, okay. All right. Okay. Are you excited?
Yeah. Okay.
Are you feeling excited about the upcoming trip?
Mm, no.
Not
Mm,
really.
yes, not really because I go to for work.
Yeah. Yeah,
Mm.
it's not for holiday. Yes. Yes, I understand. All right. And when are you coming back? You leaving on Sunday, and then when are you coming back?
Mm. I will coming back the Saturday next weekend. Next week. Yeah.
Oh, so you're flying there on Sunday, this coming
Mm.
weekend, and you're coming back the weekend thereafter on Saturday.
Yeah.
Oh, I see. Okay. All right. But we will miss you when you are there, Mr. T. We will miss you.
Miss you.
Yeah, we will think about you, and we hope everything goes well, and we will miss you
What does it
because
mean miss you?
I
What does it mean miss you?
it means like we will you are not here. We will not see you for a week. So we will miss you.
We'll miss you. No, no. I we can talk via the Zalo.
Yes. Right. Okay. Okay, Mr. T. All
Mm.
right. All right. So let's have a look. Today we're going to have a look at health and pharmacy. So hopefully, and I don't hope that you will get sick on your trip.
Okay.
But if you do get sick on your trip, in this lesson, we're going to talk about how you can handle the situation when you are feeling sick. All right. So I want to ask you this question. When you are on a trip, how do you feel when you are sick? When you are on a trip?
On the trips, when I are sick, yes, the first I think is the is alone, is the feel alone, because
Yeah,
when I stay at home, my wife and my daughter take care and help me better.
you feel better, yes.
Yeah.
But when you are alone and you're on a trip and you're feeling sick, you can sometimes feel sorry for yourself, right?
No. Uh, before I go to trip and long term, I prepare some medicine.
Yeah,
For example, in Vietnam it's dầu gió. For example, I usually using in Vietnam.
okay.
Mm,
Right, but today you're going to learn about medicine that you can use when you are feeling sick, but how you call it in English.
mm,
Okay. Right. Now, if we look at this picture here, this guy is on a trip.
yeah.
He's at the airport. You can see that he's at the airport.
Uh,
And
he 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 very tired, and maybe
yeah,
he get he has a flu.
yes, you can see that he's not happy. You can see that he's not feeling well.
Mm,
Um, he's he's got some sort of illness. So I think that this guy is feeling sorry for himself and he's longing back home. He just want to go back home now.
mm,
He's longing for his family and for his people. All right. Okay. So let's have a look. Right. Now let's have a look at the ache family. Now this is
family.
a pet. Yes, the ache. We call it the ache family. Like headache, stomach ache, back ache,
Yeah.
toothache. So that's why we call it the ache family. So we use this pattern when we say what is wrong with us. For example, I have a headache. I have a headache.
I have a headache.
I have a stomach ache.
I have a stomach ache.
I have a backache.
I have a back ache.
I have a toothache.
I have a toothache.
Right. Now I'm going to ask you, what is the matter with you? So I'm asking you this question.
Mm.
What is the matter with you?
What is
I can see that you are not I can see that you are not feeling well.
mm,
So I will ask you this question. What is the matter with you?
the matter?
So yeah. So when someone is seeing that you are not feeling well, someone will ask you this question. What is the matter with you?
What's the matter with you? I have a headache.
Okay. What is the matter with you?
I have a stomach ache.
What is the matter with you?
I have a back ache.
What is the matter with you?
I have a toothache.
Okay, very good. Okay. Right. Now, other symptoms or other illnesses that you can get is, or we all can get these symptoms. Like, for example, sore throat. I have a sore throat.
I have a sore, sore throat.
I have a fever.
I have a fever.
Or you can say, I have a high temperature.
I have a high temperature.
I have a cough.
I have a cough.
Or you can even say, I have a bad cough.
I have a bad cough.
I have a runny nose.
I have runny nose.
I think I have food poisoning.
I think I have food poisoning.
Okay, so let's practice here. Again, I'm going to ask you, what is the matter with you?
What is the matter with you? Okay. I have
Right. So first, what is the, wait for me 1 second. What is the matter with you?
I have a sore throat.
What is the matter with you?
I have a fever.
I have a fever.
Fever. I have a fever.
What is the matter with you?
I have a cough.
What is the matter with you?
I have a runny nose.
I have a runny nose.
No, runny nose.
What is the matter with you?
I have food
I think,
poisoning. I think I have food poisoning.
yes, I think I have food poisoning. Right. That is when you eat bad food, or food that is old, then one get food poisoning, or food that is just off. They're not good anymore. Right. Okay. Now we are at the pharmacy. Can you see all this medicine? Look at
Yeah.
all this medicine in this pharmacy. Wow. Right. Lots of different medicine. Right. So here we're going to know how to ask for medicine and understand basic instructions. Okay. Right. So common medicines that we get are, for example, painkillers.
Painkiller.
Painkillers. Now, painkillers are for headaches,
Headache.
for backaches,
And
and for general pain.
pain.
Yeah. Then we use, when you have a pain, say in your lower back, or you have a pain, you have a headache, or you have a backache, or you have some sort of pain somewhere in your chest, maybe, you can
uh, pain painkiller. The main material is aspirin. I think it's aspirin.
That's correct. Yes.
Aspirin.
Yes. Then you can ask the pharmacist for painkillers. Right. Then we get cough sweets or cough drops.
Cough sweet. Cough.
Yes. That is when you have a sore throat.
Or cough.
Or when you have a bad cough. Yes. Right. And then antacids. Antacids are for a stomach ache. When you have stomach pain, or when you have heartburn. Heartburn, yes. That is sometimes when a wind gets stuck. You've got a wind and it's stuck here inside. You can feel your heart is burning. That is most commonly it's because of a wind that is stuck. And then you can ask for antacids. Right, and then bandages or plasters.
Bandages, plaster.
Yeah, a bandage. when you have when you fall off a bicycle and you have a very bad wound, then you can put a bandage around your wound. Or when you have a when you cut your finger, when you're in the kitchen and you by accident cut your finger, then you can put a plaster on your finger to stop the blood. So bandages and plasters are for small cuts and wounds. Right, and then eye drops.
Eye drop.
Eye drops, we use eye drops when our eyes are feeling irritated.
For dry or beginning eye.
Yes, when your eyes are dry, when your eyes are burning, and when your eyes are irritated, then we use eye drops. Sometimes when we're outside, especially on a motorbike, then there's a lot of dirt in the air. And then, sorry, I just want to turn this off. Yeah, and then the other traffic around us, the other cars and motorbikes, they kick up a lot of dust, and that dust gets into our eyes. So
yeah, okay.
and then
maybe when you drive driving car long many hour long hour.
yeah,
Yes, mm, you you can't using road eye drop. Yeah.
yes, I agree.
It reflect for my eye. Reflect
Yes,
for my eyes better than. Yeah.
yes, I agree. Yes. All right. Okay, very good. Okay. So let's have a look at now can you tell me what is this medicine used for? What do we use cough sweets or cough drops for?
Yeah. Uh I use with cough for best cough.
Say again?
I use with uh for for cough like.
Yeah, you can use cough sweets for a bad cough, or you can use it for a sore throat. Cough drops you can use for a sore throat as well.
So so
Yeah, sore throat or for a bad cough.
for best cough. Yeah.
Yes. What will you use bandages and plasters for?
Yeah, I I use I use plaster for soft cut on the hand or on the leg.
Yeah, we will use bandages and plasters for small cuts and wounds.
Mm,
What will you use eye drops for?
mm, I use I don't use when my eyes dry or or
Irritated.
yeah irritated.
Okay. What do you use painkillers for?
I using I use painkiller when when I have a headache and or backache.
Or for general pain?
Yes, and some pain.
Okay. What do you use antacids for?
I use antacid when I have stomach ache.
Yes, when you have a
Or
stomach ache.
maybe I have maybe I have food
Heartburn.
food for sitting.
Yeah, you can use antacids when you have a stomach ache, when you suspect that you've got food poisoning, or even when you have a heartburn, right?
Heartburn.
Okay, right. So let's have a look at the medicine. Let's match the medicine.
Mm.
So here you will see this is aspirin.
Aspirin.
Aspirin. We
Yeah.
use aspirin when we have a headache.
Yeah.
So we will use aspirin when we have a headache or when we have a high
Fever.
fever. Right. We will use cough syrup
Cough
when we have a
syrup.
bad cough
Cough
or when we have a sore throat.
syrup.
We will use antihistamine.
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 Anti antihistamine.
Antihistamine
Antihistamine. Yeah.
when we have allergies.
Allergy.
Yeah. And we will also use it when we are sneezing.
Sneezing.
Yes. Right. Then we will use a bandage. We will use for
Bandage.
small,
Yeah.
for small cuts and wounds.
More fast and good.
Yes. We will use antacid
And antacid.
when we've got a stomach pain
Yeah.
or when we've got a heartburn.
Heartburn.
Heartburn, yes.
Yeah.
And then we will use a fever reducer
Fever
when
reducer.
when we have a high temperature.
Uh,
So can you tell me, what do you take for a headache? What medicine will you take for a headache?
yeah. I use aspirin.
Yes, very good. What medicine will you take for a sore throat?
I uh, I I I take the cough syrup.
Cough syrup, okay. What medicine will you take when you have an allergy?
And I take anything when I have allergy.
Antihistamine.
Histamine.
Yeah, antihistamine.
Antihistamine.
Yeah. So when you are sneezing all the time, what medicine will you take?
Using anything.
Antihistamine.
Anti Antihistamine.
Right. What will you do when you have a small cut or a wound?
I I use the bandage.
Okay. Um, when you have a stomach pain, what medicine will you take?
When I have stomach, I using antacid and antacid.
Antacid. Right.
Antacid.
And what will you do? What medicine will you take if you have a high temperature?
Yes, I take I take I take five fever reducer.
Okay, now let's practice to say. Let's practice this structure. Aspirin is for headaches.
Aspirin is for headache.
Aspirin is for fever.
aspirin is for fever.
Cough syrup is for bad coughs.
Cough syrup is for bad cough.
Cough syrup is for a sore throat.
Cough syrup is for sore throat.
Antihistamine is for allergies.
Antihistamine is for allergy.
Antihistamine is for sneezing.
Antihistamine is for sneezing.
Bandages are for cuts and wounds.
Bandages is for cuts or wound, small cut or wound.
Antacid is for stomach pain.
Antacid is for stomach ache.
Right? A fever reducer is for a high temperature.
Fever reducer is for high temperature.
Right. Now, can you tell me what of these medicine is in your home?
In my home, have some aspirin and fever reducer
Okay.
and a little bandage.
Okay. All right.
Because
Very good.
my children, the children sometimes they get high temperature.
Yeah.
Yes, yeah, and we using fiber reducer.
Yes. All right. Yes. My daughter as well, Mr. T. She also get high fever every now and then. And then we have to treat her. My daughter, the same. Every now and then, every 3 or 4 months, she get a high temperature. And then we must know there's somebody at school that were not well, and she got infected from that friend of her or somebody at school. And then we, yeah,
In the land, in the land, is the environment in the land is better for children is or middle in Vietnam. For example,
yes,
Malang City is very good for health.
yes, I agree. Mr. T. The cities, there's too much pollution in the cities in Vietnam.
Malang,
That's cool. Say again.
Malang City.
Yeah, yeah. Anything outside the big cities, yeah, or smaller towns or smaller cities, they are
Yeah,
better. Yeah, but the big cities like Hanoi and even Ho Chi Minh,
yeah.
too much pollution that causes people's noses to block. People get sick when
Mm,
they're outside. Yeah, I've heard that a lot from people. Yeah.
yeah.
All right. So let's let's use practice some phrases when you are at the pharmacy. So useful phrases for customers. You are a customer. When you are walking into a pharmacy, you are a customer.
Customer.
So, yes. So, in this picture, this is the pharmacist and
Pharmacist.
this is the customer. Right. So, this lady, she's coming into the pharmacist because she's not feeling well or she's got some sort of illness and she wants to buy some medicine. Now, what phrases can you use to help you? Right, you can ask for help by saying, for example, I'm looking for something for a cold, or I'm looking for something for a headache, or I'm looking for something for a sore throat, or I'm looking for something um, for a backache.
Yeah.
Now, say, for example, you ask for a recommendation. Now you're going to ask the pharmacist now for advice. Then you can tell the pharmacist, for example, you woke up this morning and I've got a very bad neck. My neck is very sore. And I've got a very big headache. What can you recommend then? Can you recommend something for my sore neck and the bad headache that I've got? So you can ask this question. Can you recommend something for? And then you say the ill. Yeah. Can you recommend something for? And then you say the illness that you are suspecting that you are having. Now, yes. Now, when the pharmacist prescribe you some medicine, then it's a very good question to ask this. Does the medicine have any side effects? For example, does it make you sleepy? Does it make you drowsy or sleepy? Because most medicine that contains antibiotics makes one sleepy. You know that?
What does it mean? Side effect? What does it mean?
Let me tell you. Medicine that contains, let me write it for you. Medicine that contains antibiotics. Antibiotics. Medicine that contains antibiotics tends to make one sleepy. Medicine that contains antibiotics, or let me say medicines that contains, wait now, medicine that contain antibiotics tend to make one sleepy.
Sleepy. Yeah. Okay, I see.
So that is always a good question to ask the pharmacist. Does the medicine that she's prescribing to you or that she's recommending to you, does it have any side effect? So then you will know when you take the medicine, that medicine it can might let you feel sleepy or drowsy or, you know.
I see.
Yeah. So these are very handy phrases that you can use when you have to go into a pharmacy to ask for medicine. Is you can say, for example, I'm looking for something for a cold, or I'm looking for something for a back pain, or you can ask the pharmacist for a recommendation. Can you recommend something for my headache? Can you recommend something for my stomach ache? Can you recommend something for my toothache? Can you recommend something for my neck pain?
Neck pain.
Yeah, or you can say, can you recommend something for my high fever? I have a high fever. Can you recommend something for my high fever? And then when she does, when the pharmacist recommends you, make a recommendation to you, always going to ask, does the medicine have any side effects? That's a very good question to ask. Okay. Right, so let's have a look here. Now, the pharmacist's instructions, listen carefully. These are the key phrases a pharmacist will use. When she prescribes you medicine, or when he or she, a pharmacist can be a man too, so when he or she describes you medication, then she will say, take, for example, 2 pills 3 times a day. Take two take two pills, take two pills 3 times a day.
Yeah.
Before, and then she will say, take this before meals or take it after meals.
Yeah.
Or she can say, take it every 4 hours.
Yeah.
So listen very carefully to the instructions. And usually what they do, the pharmacist, they put the instructions on your medication. They put it on there so you can read it as well. So then you know. How often must you take your medication? Must you take it? How many pills must you take? And how often must you take it? And when must you drink it? Before meals or after meals? And yeah, mostly it is after meals.
Yeah, in pharmacy in Vietnam when they sell medicine for you, the pharmacist usually look on the medicine and recommend you take it before meal or after meal before.
Yes.
Yes.
Yes, that is what is happening. Yes, I agree. All right. So let's have a look. You are now the doctor.
Right,
Right?
doctor. Yeah.
You, Mr. T, you are now the doctor. I want you to look at this picture and tell me what is the matter with this person?
Yeah.
What is the matter with this lady here? And then I want you to make a recommendation. So first tell me, what do you think? What is the matter with her?
The she had a headache.
Yes, she has a headache. Now, what
Yeah.
medication will you recommend to her?
Yeah. Yes. She take aspirin to for the headache.
Okay, very good. Right. Now, what is the matter with this man?
The man has stomach stomach ache.
All right. And what medication will you recommend to him?
Uh, he 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 used he used antacid for stomach ache.
Okay, very good. Now, what is the matter with her?
Yeah, she had toothache.
And what medication
And
would you recommend to her?
and she using the aspirin for toothache.
Right. Okay. And what is the matter with him?
He he had back.
He has a backache. And what medication will you recommend to him?
Yeah, he used the aspirin
Yeah, some painkillers.
for pain. Yeah.
Yes. Right. And what is the matter with him?
Uh, he had a bad cough.
Right. And what medicine will you prescribe to him or will you recommend to him?
Yeah. He he takes he takes a cough switch
Okay.
for bad cough.
All right. Okay. And what is the matter with this boy?
Mm, he has a short cough,
He has a sore throat.
a short cough, and he take a cough with.
Okay. Right. Okay, very good. Excellent. Right. Now, what do you think is the matter with this lady over here?
Ladies sitting on the chair. I think I think maybe he see fever.
She has a high fever.
Yeah, he had fever.
Okay. Right. And what medication will you recommend to her?
Uh, uh, he take five reduce
A fever
fever reduce.
reducer. Yes. A fever reducer. Okay, very good. Okay, well done. Right. So let's describe the symptoms clearly. So when you are ill, we use this sentence structure. I have a stomach ache, or I have a back ache, or I have a toothache, or I have a sore throat to explain how you feel. When you ask for recommendations, when you are in the pharmacy, then you can you recommend something for my sore throat, or can you recommend something for my stomach ache? And then listen always very carefully for the dosage. How many pills and when and how often you must take it. Okay.
Okay.
That's the key takeaways of this lesson. Right, let's go here. Let's do a few exercises. Right, now let's match the illnesses and injuries to their definitions. So let's have a look at the words in the box first. The words are a cold, a fever, a headache, a sore throat, a sprained ankle,
ankle,
a stomach ache.
stomach ache.
Okay, can you read sentence 1 and give us the correct answer?
It makes you feel hot and cool.
Hot and cold.
Hot and cold. Yeah, you had you had have fever.
That's right. Number 2,
Your nose is sore.
yeah, your nose is sore.
Your nose is sore. It's you know, so it's it's cool.
You have a cold.
It's cold. Yeah.
Right, number 3,
And the it hurts when you walk. Uh, you have the bandage ankle.
you have a sprained ankle. Yes.
Then
Right, number 4,
for you stomach hurt, you have a stomach ache.
right, number 5,
But why your foot hurt? Uh, you have short foot.
okay, number 6,
Your head and eye hurt. You have headache.
Okay, very good.
Uh,
Right.
I'm sorry. With me, 1 minute. I
Okay.
open the door for my wife. Yeah.
Okay. All right.
Okay. I come back.
All right. Okay. So let's complete the sentences with the correct word. Number 1.
Number one. I eat too much, and now I have a toothache.
I ate too much and now I have a stomach ache.
Stomach ache. Okay.
Yeah. Number 2.
I need to dentist. I have a toothache.
Right. Number 3.
Number three. Look at this spot and
All over my arms.
over my arm. It's some kind of cut.
It's some kind of rash.
Right?
It's some kind of rash. Number 4.
Or you your fever is very high.
Look, it shows
so
39 degrees.
39 degrees Celsius on the
Thermometer.
thermometer.
Right. Number 5.
And the price I had I had a thought. It
Yes.
really hurt when I eat.
Okay. And then number 6.
Number 6, I had a bad cut on my finger. It's bleeding a lot.
It's bleeding a lot. Right. Okay. Now let's read this passage quickly. A day in Bangkok. Right. Can you
Yeah.
can you read this part?
Yes. Today is first day of Lam's vacation in Bangkok. However, he doesn't feel well. He has a terrible headache and a runny nose. Runny nose. He thinks he has a fever because he feels very hot. Lam goes to a pharmacy near this hotel. He said to the pharmacist, I need something for a cold and
For a
fever.
cold.
A cold and fever. The pharmacist give him some painkiller and a thermometer
A thermometer.
to check his temperature. Later that afternoon, Lam's friend Hoa also feel sick. She eats some
She ate.
fish food and now she had a stomachache. She need to buy some antacid. They hope to feel better tomorrow to visit the grandparents.
All right. Now, let's answer these questions, true or false, or these statements. Nam has a toothache. Is that true or false?
False.
It is false. Nam has a fever and a runny nose.
Yes, the true.
Right. The pharmacist give Nam some antacids.
False.
False.
Yes.
Wa has stomach ache because of the food.
True.
That's true. Right. Okay, Mr. T. We are finished for today, doctor.
Yeah.
You are a good doctor now. You are a good pharmacist. You know now everything about medicine.
No, I have a student. I have a learner. Yeah.
No, you've done very well. Okay, see you tomorrow.
Yeah. See you tomorrow. Good night.
Good night.